Hello, my name is Dr. Dewan S. Raja. Today I will discuss about scabies. Scabies is a contagious skin disease caused by a mite called Sarcoptes Scabiei hominis. This is an ectoparasite that lives and burrows in the upper skin layer. Our skin has epidermis, dermis. Epidermis has the stratified squamous keratinized epithelium. So in the upper layer of the epithelium, the scabies lives. It burrows there in the stratum corneum. About 200 to 400 million people are suffering from this annoying disease throughout the world. Scabies can occur to anyone, irrespective of race, sex, age, or country of residence. It may be in the Arctic, may be in the tropic. It is more common in resource-poor, overpopulated tropical countries like Indian subcontinent, like Southeast Asia, but it may happen in any countries, any weather. It is also common among children and in the elderly, in prisons, daycare center, nursing home, in schools, especially elementary school in a poor country, and also in refugee camps. The female parasite makes a tunnel through the stratum corneum of the skin, lays eggs and passes feces in the tunnel called sciba. Any body part may be infected by scabies. Usually it does not happen in the face or scalp, but in case of children, in an adult, it may be in the face and also in the scalp. So it has a predilection for the skin over the finger web between the finger, okay, maybe in the wrist, in the abdomen, on the breast, on the genitalia, on the scrotum, okay, anywhere, even in the leg, in the palm, in the sole, okay. So any body part may be infected. It is contagious and spreads through one-to-one contact or sharing clothing or fomite like furniture, door handle, okay, towel, or sharing same bed with a person who has scabies, or maybe due to one sexual partner has scabies, another sexual partner will get also scabies due to direct contamination. Symptoms appear after 4 weeks of infestation. Patient complaints include itching. It is intense itching, pruritus, rash, soreness, and secondary infection due to itching caused by staphylococcus or streptococcus infection like impetigo. Outbreak of scabies are risk factor for kidney disease. Okay, so from the secondary infection in the skin, a person, a boy or child, or maybe adult person may have renal disease like glomerulonephritis, may have kidney disease like glomerulonephritis, heart disease, and rheumatic fever, rheumatic arthritis. Usually 10 to 15 mites are present in an infected person in a typical scabies. Okay, but we have another scabies called Norwegian scabies. In that condition, there will be crust formation. We may have many thousands of Sarcoptes Scabiei in one person. in Norwegian or crusted scabies. Okay, so this is the female mite here. These are the mite dropping called sciba, and these are the mite eggs. So the female make a bar on the skin, go in the stratum corneum layer. Okay, this is the scabies, female scabies here, and this image has been taken from Google. Credit is Google, the Creative Commons. Okay, so we got skin layer. This is here, stratified squamous epithelium here. Stratum corneum is here. Okay, and we got the mite. Mite size in case of female, in the female mite is around 0.32 millimeter. 0.32 millimeter on average. Male is little smaller, maybe 0.2 millimeter. Okay, so scabies, here the life cycle eggs, then we'll get larva, nymph stage, then adult male, okay, adult female. This is size 0.3 to 0.45. Male is 0.2 to 0.25. Male are not usually found on our lab test. Okay, its lifespan is even smaller than that of the female. It's only one purpose to mate with the female, then it usually dies. Okay, so we got the adult female, and lifespan of the female is around 1 to 2 months. Each day a female may lay 3 or 4 eggs. Okay, so the female remains fertile throughout its lifespan once it is mated by a male. The male dies after mating. Okay, this is the Norwegian scabies or crustal form of scabies. Here many thousands of parasites, not only thousands, maybe many thousands of parasites are found in the body, and is called Norwegian scabies. Crusted scabies are more common among people with low immunity. Person is on steroid for long time. Person has long time diabetes, mellitus, or cancer. Okay, or person has history of steroid and having organ transplantation. Elderly people in nursing home. Patient with history of HIV infection. Okay, so we'll get here Norwegian. We'll look at the image. We will get crusted. Okay, and it has, this person has many thousands of parasites, not only 10 to 15. Okay, so we got that. Treatment, we have medical treatment. Scabies is treated by lotion like permethrin, benzyl benzoate, crotamyton, linden. Linden shouldn't be taken during pregnancy and children. It may cause in pregnant women neural tube defect, the teratogenic effect. Okay, benzyl benzoate is very popular and also cheaper, found in many countries. Permethrin is the best. Okay, so we got another is the crotamyton, especially for children, but efficacy is not so good. Okay, but we have oral medication like ivermectin or moxidectin, especially for the Norwegian type of scabies, crusted scabies. Lotion may not reach inside, so this is the drug of choice, either ivermectin, even better moxidectin. Prevention, scabies should be treated as soon as possible once it is diagnosed. Diagnosis by clinical feature will get a burrow, will get a tunnel, and maybe linear or serpentinous skin papule will get that. We may have skin scraping. We may find out the parasite under the microscope. Okay, or we may have PCR in certain situation. Okay, so treatment is required for all household members at the same time. These lotions are usually put over the body, usually below the face, provided face is not also affected, to the toe in the early evening, and they will have shower after the following day morning. So it should be around 8 to 12 hours, and it may be used more than one time, one more time after 2 to 3 days later. So the remaining mite may die. Okay. So health education regarding hand washing, avoiding contact with infected people, regular showering, and laundry. So laundry, washing the cloth in hot water, and also drying the clothing linen in a dryer. The linen or clothing which cannot be washed should be put in a polythene bag, and it should be under the sun for 3 days, because the parasite will die within 40 to 72 hours if it is exposed to sun. Alternative herbal therapy that is very popular in many parts of India. Topical application of paste made from turmeric, a spice, and neem leaves, very common in Indian subcontinent. Okay, so this paste should be applied to the entire body. Okay, neem oil and tea oil are also advocated to put on the body. And that's all about the scabies. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.